for frontline and essential workers in order to ensure that we're able to continue to address our current public health crisis and enable our local economy to move forward. I would like to thank Kevin Harbour, President of the BizFed Institute, and Tracy Hernandez, the founding CEO of the LA County Business Federation, for their leadership and collaboration during this pandemic. Their business platform has been instrumental in mobilizing their membership to find and collect tax-deductible donations of much-needed vital PPE supplies to help protect our workers throughout LA County and mitigate the spread of this virus. I would also like to thank Castro de la Rocha, President and CEO of AltaMed Health Services Corporation, and Berenice Constant, the Vice President of Government Relations, for their incredible partnership in this effort to ensure their frontline and essential workers who provide services to low-income and immigrant communities of color have the protections that they need to be able to do their jobs properly. AltaMed services 300,000 residents in Southern California, including communities and families in my district and throughout all of Los Angeles County. They have a reputation of exemplary healthcare services by ensuring patients in need of medical attention are never turned away, regardless of legal status. Lastly, I would like to thank my family from SCIU, April Verrett, as well as Kim Yvonne, who's here with us today, with SCIU Local 2015, the nation's largest long-term care union, representing more than 385,000 home care and nursing home workers throughout California, and the largest percentage being here in LA County. Kim Yvonne will make some remarks in a little bit. Although COVID-19 has had devastating impacts on our families, our neighbors, our economy, and our everyday lives, the virus has also brought us together. As a city, state, a nation, and a global family, we have been able to adapt to this unfortunate new normal and have challenged us to collectively think of creative and innovative solutions to address some of these obstacles. Providing these masks, which you see in these boxes today, to our frontline and essential workers is personal to me. My mother is a home care worker. She takes care of a 92-year-old lady in East Los Angeles, in the community that I represent, who would otherwise be on her own. She takes her to her doctor's appointments. She shops food for her. She makes sure that she has a dignified life living at home. My mother is 61. She's right at that age where we worry about her every day. My father is a custodial worker in janitorial maintenance service in the Chinatown community of the city of Los Angeles, also a district that I represent, and you see how clean the streets are because of people like my dad, who every day continue to do the work necessary to ensure that our community thrives. So this is incredibly personal to me. On another side note, my grandmother was a nurse in our home country of El Salvador, and when she came to the United States, she was not able to practice because of language barriers and license barriers, but she worked for AltaMed in the PACE program, and she also cared for the most vulnerable in our communities. And I know she would always tell me, you will always have a job in healthcare anywhere in the world. And I know that if she were here with us today, she would be trying her best to try to advocate for the nurses and the doctors and essential frontline workers that continue to do this work. And I know that she would be so glad and proud that we are doing this effort to service the community that she loves so much. So I'd like to dedicate this incredible donation in her honor and so many of our essential and frontline workers who continue to risk their lives every day to ensure that people with the most vulnerable in our community have the health care that they need and deserve and that are worthy of. So again, I'm so grateful for this incredible partnership with the BizFed Institute, the Chinese American Federation, SCIU California, SCIU 2015, and so many of the other locals that are going to be receiving some of this incredible, much-needed PPE. SCIU will be distributing thousands of these masks to nurses, doctors, and medical personnel throughout all of LA County. And lastly, though we are all unsure when the state of California or the city of LA will lift the stay-at-home orders or when this pandemic will subside, we can guarantee that in the meantime, frontline workers, essential workers, heroes like the ones that are standing here today, will continue to rise to the challenge and meet this adversity. We all continue to serve, to give, and show love throughout COVID-19, and we keep the faith, we are optimistic, and believe that there is always a rainbow after every storm. Now, let me introduce, it is my pleasure to introduce Simon Xiao, the President of the Chinese American Federation.
Okay. I think it's better take all night. Thank you so much, Wendy. It's pretty touching for her speech. Actually, my parents, my sister and brother, they both are doctors in China, so we get the same feeling. Good morning, ladies and gentlemen. My name is Simon. I'm the president of Chinese American Federation. We are one of the largest Chinese American association in the Southern California. Founded 16 years before, comprising around like 120 associations and business collisions. When we found the virus swept over the United States, we knew we needed to take care of our community. Our first donation right after we founding that our frontline hospital doctor lack of the medical supplies. We try to raise the money, we try to collect all the donations to buying everything we can find from anywhere, such as in China, in Hong Kong, and even in Singapore, for all the N95, the surgical mask, the isolation guns, and the face shield, everything we can find. So, because the virus is swept so fast, and our team work every day. I know they take the action and volunteer every day under the risk of the coronavirus. I'm very proud to announce today, until right now, from the beginning of the 40 days before we begin our first donation, we already donated to over 40 different organizations. And I think including 30 of the hospitals, several of the nursing homes, senior center, and the law enforcement agencies, and even some of the orphanage and the prison, and several of the CVS and Walgreens. We try to be everywhere we can help. I still remember when I first got to the hospital in the Whittier, the CEO, his name is Patrick Cattrall. I still remember he talked to me with the tear in his eyes. He said, "Thank you so much for Chinese American Federation. Everything could help. You might save some of our employees' life." I still remember our longest donation is went to the Columbia University Medical Center. I still remember one of the most dangerous donations is going to the St. Vincent Medical Center that just bought by one of the Chinese Americans. His name is Patrick, and that one is only for the coronavirus parents, but we still be there because we know the community need our help. I can't believe until right now we already donated over 252,000 of the surgical and the N95 masks, and thousands of the isolation guns, and the face shield, and the kind of goggles, everything. The virus is there. I think, ladies and gentlemen, this is what I'm thinking. We are all together. We are all in the same situation. The virus doesn't have discriminate. And coronavirus is living amongst us, and is allowing us to learn how to beat this battle with the love and the support of our community. We are all on the same boat, Let us be united in defeating this pandemic. Last, I want to say, God bless America. United, we stand. Thank you.
Hello everybody, I'm Dr. Nan Shapiro. I'm the Medical Director for Health, Education and Wellness, and it's my honor and pleasure to be among such an amazing group of people. I just represent what the tiny part of the sword that we're having against coronavirus right now in front of us. We were giving the example a couple of weeks back. When you have a war, you send your soldiers with your shield, with a sword, with ammunition. But without this, that is our shield, we cannot have a sword to make a difference against the coronavirus that is attacking all of our communities. This is an example that this virus does not distinguish gender, preference, religion, where you're coming from, what's your culture. If you're red or blue, it doesn't. This virus, if you're human, you're a target. It doesn't matter if you're 0 or 120. We are all targets. In the front lines, this has been actually a couple of hard weeks. We're reaching out in a matter of telephone visits, video visits, mental health visits, and in-person visits with the people that actually need it. And hearing the stories of people that already have left us because of coronavirus, the healthcare workers that have been already exposed to it and have lost their lives fighting this gives an entire importance of the work that we're doing as a community. That we need these shields, with these partnerships, with this leadership, to go out there and make sure that we all are safe and we do something for our families. We need to remember that until now there's no special poison or potion or a miracle vaccine. The only thing that we have is us. The unity that we can create between us, creating that social distancing, but not putting our hearts apart. Whenever you need, for example, healthcare, vaccines still need to be given. Diabetes is not going away anywhere, right? We still need to take care of us, because if we're strong and healthy, with a balanced diet, sleeping ourselves, and even though that we're inside of our houses, we're actually moving, all of those are shields that we can protect our community. Then I'm extremely thankful for being here and actually sharing this. And we have cried a lot, our nurses, technicians, doctors, we have cried a lot from happiness and at the same time with some type of sadness, because we are all in this together. There's no way that we're going to go back to normal. This is our new normal, and we need to attend that. There will be mental health stress, dental health stress, medical health stress. But with this type of partnerships, I'm sure that we're going to make a difference. Then thank you. That's it.
Good morning, I'm Tracy Hernandez, the founding CEO at BizFed, the LA County Business Federation, and the BizFed Institute. Today marks a really interesting dynamic in the greater LA region. This is an unprecedented coming together of government. All 39 senators and assembly members that represent everyone in LA County have leaned in to find donations and to get them to the street quickly to our frontline workers. Assemblymember Wendy Carrillo, super champion. She was one of the very first to raise her hand to say, we're going to make a difference. We didn't stop there. We went to LA County, Supervisor Catherine Barger, all 5 county supervisors, the county itself said, yes, we will lean in. Let's work together to help all frontline workers. We didn't stop there. SEIU, the Service Employees Union, all 5 locals that represent all of LA County said, yes, count me in. I'm there. We need to help our workers and get them PPE. So BizFed is a conglomeration much like the Chinese American Federation. We have 195 different business associations, chambers of commerce, industry trade groups, minority business groups, women business groups, you name it. 435,000 companies have agreed this is critical. Our frontline workers need PPE today. So what's different about this organized effort is the speed in which we act. The Chinese American Federation raised their hand and said, I have 50,000 masks. They spoke to Assembly Member Wendy Carrillo. That was 3 days ago. We are here today handing it off to Dr. Shapiro, to the workers on the front line that are saving lives, that are risking their lives every day. 3 days time from I have a donation, I have a recipient, to us delivering it. Speed is of urgency, we understand it. We are so pleased to do something about it to help all workers. So our healthcare workers, our nursing home workers, our janitors, our grocery store workers, everyone who has to keep the services up and save lives. And it's the generosity of the Chinese Americans in general. Another group of Chinese Americans gave us our first 50,000 masks that we gave out last week. The Federation this week. The Chinese American citizens and business owners and leaders are really stepping up to do their part, and we say thank you very much. Congratulations to all the workers. Thank you for what you're doing. We appreciate it.
Good morning, everybody. My name is Kim Yvonne, and I am a proud Executive Vice President of SEIU Local 2015 that represents, as Assemblywoman Carrillo said, a little over 200,000 long-term care workers, frontline, essential, vital workers who are battling in their communities and in facilities this COVID-19 pandemic. And I want to appreciate this notion of speed. I am here today to tell you the stories about why urgency and speed is required in our actions, and why, on behalf of the members of our organization, we thank you for acting with that speed and urgency. 6 weeks into this pandemic, we still hear stories of workers like Dolores Solorzano, who works in a skilled nursing facility and every day still has to go to work without the proper personal protective equipment that she and her co-workers need to safely provide the care to those residents and to care for themselves and their families that they go home to. That she and others are working in the epicenter of this pandemic. 40% of the deaths related to COVID have happened in our skilled nursing facilities. So the urgency, the speed in which we must act, Dolores needs that speed and others need that speed. I'm here to talk to you on behalf of workers, in-home support service workers like Dina Lopez, who has had to basically sew together makeshift masks, not the personal protective equipment she and other home care workers need to protect the seniors and people and children with disabilities that they care for in the safety of their homes every day. This is a call for urgency and speed, and they are grateful for this partnership, for the individuals around us here today who acted with urgency and speed, and we need to continue to do so, and we have to act like our lives depend on it, because they do. So thank you very much.
Well, thank you everyone for all your wonderful comments. I think, Kim, to your point, the notion of acting with urgency is urgent, because you're absolutely right. Lives really are on the line, and our community is dependent on it. This concludes our program for this morning. Again, I want to thank the Chinese American Federation for your incredible, incredible contribution. And I will say this, that as we see a rise of Asian American hate crimes across the nation, this is a moment in which we recognize the community comes together when it needs to come together, because we are one big family across the city of Los Angeles, the county, the state, the nation, and certainly around the world. The coronavirus doesn't discriminate. You can get the virus by not being careful, by not washing your hands, by not covering your mouth, by not practicing social distance. And we've seen that happen over and over again. So I would urge everyone here to continue to practice the health regulations that have been enforced by the experts that know, by the scientists that know, and that we continue to ensure that our frontline and essential workers have the protections that they need so they can do their jobs and protect our most vulnerable families across the county of Los Angeles. I also want to thank the other 38 members of the California legislature that represent the county of Los Angeles. My colleagues and I have been working diligently on these efforts, and because we came together, we're able to form these incredible partnerships. So again, thank you to my colleagues, the Chinese American Federation, BizFed for their incredible contribution in bringing the business community involved in this effort, AltaMed for the continued services that you continue to provide to our most vulnerable residents across the county despite legal status, and of course to all of the frontline and essential workers that continue to do this work. Thank you all. This is amazing. 50,000 masks, surgical masks, and 500 N95 masks that are going to be used immediately as soon as we conclude. SEIU will be taking theirs to their locals and their workers. AltaMed will be receiving some, as well as some other essential and frontline workers across LA County. So we are just so incredibly grateful. If there are any questions from the press or media, we'll take them now. So, again, thank you all so much.
And thank you for your leadership. President Johnson. Yeah. They have to do it right now.